Welcome back to County Connection. For this next segment, we're going to be talking about Building Hope, a relatively new organization on the Summit County nonprofit scene. And here to tell us all about it is Jen McAtamney, who's the Executive Director of Building Hope. Welcome, Jen.
Thank you. It's so nice to be here and chat with you guys. Yeah.
Jen, so for folks who may not be familiar with Building Hope, can you tell us what it is all about?
Yeah, sure. So, in 2016, we had a number of really longtime locals had committed suicide and took their lives, and it was very tragic for our community. And out of that was a groundswell, primarily through the Casey family. And they came together, worked with the Summit Foundation, and brought community stakeholders from all over Summit County to really say, we're going to do something about mental health and the issues that we face in our community. And out of that became Building Hope. What that was a really grassroots movement around reducing stigma, creating a more coordinated and effective and accessible system for behavioral health. So for everyone in Summit County. And what was so amazing is the Summit Foundation really was the initial sponsor. FERC then incubated the organization within theirs. Betsy Casey was really the primary mover and heart and soul of it, and created over a bunch of years, last couple of years, a number of programs and program areas that Building Hope would concentrate on, really to, like I said, reduce stigma, coordinate the system, try to understand what the mental health system looks like here, what care is available, what do you have to go elsewhere, and also created opportunities to make sure that it was accessible for local people.
Right.
So last fall, as the organization grew and thrived in FERC, then last fall we had the big ballot initiative, the Strong Future, most people call it 1A, and that passed. And at that point, it was a critical juncture for the organization, and they made the determination that the best thing to do going forward was become our own 501c3. So April 1st, we separated from FERC and the Summit Foundation, and we now have our own offices on Granite Street in Frisco, and we are now delivering all the programming that we did through FERC and the Summit Foundation on our own. It's really super exciting. And then we also serve as the community advisory group for the Strong Future Initiative funds around mental health.
Awesome. So Jen, can you, so one of the areas that Building Hope focused on in a big way, but maybe hadn't really been addressed, certainly not on this scale before in Summit County, is stigma reduction.
Yeah.
Can you talk about why that was such a priority, and then what that stigma reduction work looks like?
Yeah, so obviously, for years, you think about cancer a long time ago when you and I were young, there was a lot of stigma around cancer. People didn't want to talk about it. It's sort of like, I have cancer. Well, today we're facing those same kind of issues around mental health. I have depression. And really, it's just your brain being sick. And so what we believe at Building Hope is, in order for people to seek care and normalize this is stuff that happens to everyone. 1 out of 4 adults experiences some kind of mental health issue somewhere in their life. So 25% of the people, that is who is diagnosed. So people that go with depression or an anxiety that's never diagnosed is higher. So this is something that affects all of our lives. And without being able to talk about it in an honest and true way, we can never really fix it, right? People are afraid to get help or concerned that someone will know that they're getting help. But the reality is, it's just your brain is sick. Just like, in Summit County, we talk about our knees, we talk about our shoulders, and
my knee is sick.
Yeah, we have no problem with that. And we really want to see the same thing around mental health, whether it's depression and anxiety, whether it's a substance use disorder, any of those things should be able to be common conversation. Because what we find when people are able to open up about them, first of all, they find out they're not alone. And there's a lot of people who are experiencing that same thing. They also are more likely to seek help. And we know, because they've done much research on this, that when people get help, we have really good outcomes, whether it's depression, substance use, even more serious and persistent mental illness like schizophrenia or bipolar. People can live really full, wonderful lives as long as they get the help that they need. And so removing stigma around it and making it just normalized is something that we think is the number one step that we have to take in order to address it.
Awesome.
Yeah, and some of the work we've done over the last year, we actually partnered with the Katz Amsterdam Foundation, which is Rob and Elena Katz's of Vail Resorts. That's their personal foundation that they have funded and really have targeted towards mental health. So they funded a campaign, and you may have seen it around town. We call it the It's Okay Not to Not Be Okay campaign. So we had bus wraps, we had the greeting cards, we had bar coasters, radio ads, really just talking about that it's okay to not be okay. And honestly, Julie, like the results from it so far have been incredible. We have this amazing scholarship program where locals who can't afford it or have a high deductible healthcare plan and really need access to therapy, they can come to Building Hope or to FERC through our mental health navigators or the care clinic. Soon we'll have other agencies will be able to issue these same scholarships, and they just work with the mental health navigator at those sites, and they can access 12 sessions of therapy for free.
That's amazing.
It is amazing. And we saw like a huge uptick in therapy over the spring months while we were running that campaign. So we really believe that the work we were doing on the street, really just normalizing the conversation of it's okay to not be okay. It's okay to struggle. If we share our struggles, we can heal around them. So we think that we really, and we actually have done some surveying now, and we have some statistically significant results that show us that that campaign is really working.
Awesome.
Yeah.
So what kind of feedback have you gathered either through the survey or anecdotally about some of, I mean, obviously you're seeing some of the numbers just in terms of participation in programs, but what else are you hearing and seeing?
Well, we just heard great things. Like we had one gentleman who posted on Facebook, he put a tattoo on his chest and he had it tattooed backwards and it said, it's okay to not be okay, to remind himself every morning when he woke up that it was truly okay. And that, you know, by seeking help and talking about and reaching out. So not only did he take the ultimate step of sharing that with his body and have something, a positive message for him every morning when he wakes up, but he posted that on Facebook. And so it's things like that. And we've got so many outpourings to our Building Hope Facebook site. We had really good participation in our mental health awareness where people were making pledges around what they were going to do for self-care. You know, and people really felt like the greeting cards and the bar coasters actually sparked conversations that made it easier to talk about mental health issues. So
that's really amazing to see how much the needle is moving in a relatively short period of time.
Yeah, now we just have to find some more money so we can continue running that campaign. So right now is the plight of every nonprofit.
Right.
So, but we know we've got something
Clearly.
Exactly. Yeah, we know we've got something successful, so we're going to continue with it. We'll be launching that same program in Spanish because
Excellent.
we know that there is even bigger barriers in our Latinx community around seeking help for therapy. So even there, we've taken different approaches where we have more of a peer support network because that's something that's easier and more culturally appropriate for people to access. So FERC has an incredible grant to create a program called Almas, which is a peer support network. So, you know, for those of you who aren't familiar with mental health, there's all kinds of places in the continuum where you can get help. It could be a peer, just someone to talk to. It could be an advisor. It can be, you know, what we think of as normal therapy with a therapist of various different education levels with varying specialties. And on the Building Hope website, we have a database of local therapists, and on there it tells whether they take insurance, whether they're part of our Building Hope scholarship program, what they specialize in, and you can search that. It's buildinghopesummit.org. Under resources, you'll find therapy.
Awesome.
So, yeah.
And so you really act as a kind of clearinghouse for mental health in the community.
Yep, I call it the conveners of mental health issues. We also do a lot of work around systems. So really, we had a grant to actually look and map out the systems, what was available here from a resource standpoint and what was not, where the gaps were. And that is really where 1A came in, right? And Strong Future, because it was clear after doing that system mapping, they took 15 different surveys that had been done over the last 10 years and overlaid them all, figured out what we had and what we didn't have, and then worked with this community stakeholder group to really prioritize those needs.
Right.
And now that those funds are available, through Building Hope, we've assembled a committee called the Strong Future Committee, and we work at Building Hope with the Mental Health Colorado to put together requests for proposals. So those are really technical documents about whatever the services that we're looking at. So the first one we rolled out was mental health navigation. So we worked with Mental Health Colorado to basically design a program that's evidence-based that we knew would work in our community. We put that out through the county website and then out to our network of mental health providers and through Mental Health Colorado circulated that around the state, and then we had proposals come back, and then our committee, which is made up of law enforcement, people with substance use experience, people who are therapists, people who are family child advocates, a community funder, a consumer of mental health. So a really nice broad spectrum and representative of our community with expertise and experience in the field.
And so many of the right perspectives to say, you know, I touch the system in this way, and here's what I'm seeing.
Exactly.
Yeah.
So that group then comes together, they review those proposals that we receive, and we then make a recommendation that goes up to the Board of County Commissioners, who then approve or accept that recommendation, and then the county does the contract, and then those services get delivered into the community.
Perfect.
So
for our next segment, we're going to do a deeper dive into all of those programs funded by Strong Future. But before we wrap up this segment, how can people get in touch with you? And are there any other programs that, before we dive into Strong Future, that you want to highlight?
Oh, yeah. Well, first of all, you know, to find out more about Building Hope, buildinghopesummit.org is our website. We have offices in Frisco at 701 Granite Street. We're open every day, or weekdays, of course, for people to stop in. So through our office, we do offer scholarships. You can also access those through FERC or the Summit County Care Clinic currently. We also have our connecting events. So on our website, under events, you'll find we have created a tremendous offering events. We do between 4 and 8 per month, and they are all free. When you go to an event, you will have opportunities to connect with people in the community who are also participating. They can range from trauma-informed yoga to art classes to panel discussions to sound healing even. What is really amazing is when we approach those events, we make sure that there is no barrier for entry for anyone. So people really from even many of them are appropriate for children, can participate all the way up throughout our community. We make sure that there's an opportunity to connect with people, and we also make sure that when you leave the event, you have some new tools for managing your own health or self-care, as well as connecting you to resources around mental health. So it's a really deliberate program, and you can find that calendar on our Facebook site, on Eventbrite, as well as on our buildinghopesummit.org. Under events, you'll see a monthly calendar, and we usually have events scheduled out for like the next 3 months. The other really exciting thing is we're now partnering with people like Rotary, so Rotary will be sponsoring all of our connecting events in November of this year.
Very cool.
So there's opportunities for organizations to get involved. Another thing we offer, and this is really out there for all of you guys who have companies and have employees and want to be able to help your employees when they are in crisis, we have this mental health navigation training. We have a grant through the Colorado Health Foundation to deliver trainings to people in the community, and this training is highly relevant for everyone. This is basically, if I am a Summit County resident and a loved one or a friend or a coworker is in distress or needs therapy or needs to find better ways to connect with people in the community, we basically walk you through, here are the resources in the community, here's the phone numbers, here are the websites. Those are other things that I think are most important to highlight in terms of our work that really are touching people on a daily basis.
Awesome. It's really tremendous. Like, what an incredible new set of assets to really strengthen and support this community.
Well, it's really wonderful. We really are, people are looking around the state at Building Hope and Summit County as a model for really addressing this stuff in a really significant way. So we're pretty lucky.
Yeah, awesome. All right, we're going to take a quick break, and when we come back, we'll talk some more with Jen, specifically about new programs that are available thanks to Summit County voters through Strong Future.